Does fasting affect lipid panel results? Imagine getting your blood tested and wondering if what you ate yesterday could change the numbers. That's a common question when it comes to lipid panels and fasting. Let's explore what really happens to your cholesterol and triglyceride levels after eating. Traditionally, doctors recommended fasting for at least 8 hours before a lipid test. The goal was to get the most accurate picture of your cholesterol levels without food influencing the results. But recent studies show that for most cholesterol measurements like total cholesterol, low-density lipoprotein cholesterol, and high-density lipoprotein cholesterol, fasting makes only a tiny difference. For example, low-density lipoprotein cholesterol, often called bad cholesterol, might be about 4 milligrams per deciliter higher if you are not fasting. This small change usually doesn't impact your health assessment or treatment plans. However, triglycerides, which are another type of fat in your blood, are more sensitive to recent food intake. After eating, triglyceride levels can spike because of dietary fats forming particles called chylomicrons. These particles can cause triglyceride numbers to rise significantly, especially in people who are overweight, have diabetes, or inherited lipid disorders. For these individuals, fasting before a blood test helps get a true picture of their triglyceride levels. From a practical point of view, non-fasting lipid panels are easier and more convenient. They are safe for most people and reflected your everyday metabolic state better than fasting samples. Many health guidelines now support non-fasting testing because it simplifies the process and reduces patient discomfort. Still, if your triglycerides are high in a non-fasting test, or you have a history of hypertriglyceridemia, your doctor might ask you to fast before a follow-up test. When it comes to calculating low-density lipoprotein cholesterol, most labs use a formula called the Friedewald equation. This calculation becomes less accurate if triglycerides are above 400 milligrams per deciliter. In such cases, fasting samples or alternative tests like non-high-density lipoprotein cholesterol or apolipoprotein B are better options. In summary, fasting is generally not necessary for routine cholesterol testing. But if accurate triglyceride measurement is important for your health, fasting can still be helpful. This approach aligns with current medical practices for managing hyperlipidemia and assessing your risk for heart disease.